You're staring at a pile of paper vet records scattered across your kitchen table, trying to remember which dog got their rabies shot last spring and whether the cat's flea prevention is overdue by 2 weeks or 2 months. If that sounds familiar, you're not alone. I go by Jasmine Caldwell, and I'm a professional pet groomer who spent nearly a decade working with dogs of every breed and temperament. And I live with 4 rescue dogs of my own, each with their own vaccine schedules, prescriptions, and vet appointments that never seem to line up. You're listening to Total Pet Parent Podcast. Quick note before we get started. The research, all the information, and the script you're hearing were written and verified by me and real human experts, but the voice bringing it to you is AI generated, which helps us get episodes out consistently every week. Anyway, I'm genuinely glad you're here, whether you've been listening for a while or this is your first time tuning in. New episodes come out every Monday, Wednesday, and Friday, and today we're diving into something that trips up a lot of multi-pet households, keeping track of vet care without ending up buried in paperwork and missed appointments. Let's get into it. Managing vet care for multiple pets can feel like running a small medical office from your kitchen table. I've got 4 rescues at home, each with their own vaccine schedules, prescription refills, and annual exam dates, and I've learned the hard way that chaos multiplies fast when you're juggling more than one animal's health records. Over the years grooming dogs professionally, I've also watched countless clients struggle with this exact thing, forgetting which dog got rabies last year, losing track of whose flea prevention is due, or showing up at the vet with the wrong pet's paperwork. This is going to walk you through the systems I use both at home and recommend from the grooming table, covering vaccine tracking, record organization, preventative medicine schedules, and the daily logistics that keep managing multiple pets from becoming completely overwhelming. Now, let's talk about core vaccine schedule tracking. Start with a master calendar that lives in one consistent place. I use a wall calendar in my mudroom where every pet's name gets a different color marker, but digital calendars with repeating reminders work just as well. The key is that everyone in your household can see it at a glance. When you're dealing with dogs, cats, and potentially small animals under one roof, vaccine schedules rarely align, and missing a booster can mean restarting a series or risking disease exposure. Map out each pet's core vaccines by species and age group. Dogs typically need DHPP, that's distemper, hepatitis, parvovirus, and parainfluenza, boosters every 1 to 3 years depending on vaccine type, rabies every 1 to 3 years per local law, and possibly bordetella every 6 to 12 months if they're groomed or boarded. Cats need FVRCP, which covers feline viral rhinotracheitis, calicivirus, and panleukopenia every 1 to 3 years, and rabies on a similar schedule. Small mammals, like rabbits, may need RHDV2 vaccines annually, depending on your region. I write each pet's next due date directly on the calendar the moment I get home from the appointment. Track which pets are on 1-year versus 3-year protocols. Not all rabies vaccines are created equal. Some formulations are labeled for annual use, others for triennial, and your vet's recommendation may vary based on the pet's age, health status, or local regulations. My senior shepherd gets 3-year rabies shots now that she's past the puppy stage, but my terrier mix who boards frequently gets annual bordetella. Don't assume all your pets follow the same timeline. Note puppy and kitten series separately with clear end dates. Young animals need a sequence of boosters, typically at 8, 12, and 16 weeks for dogs and cats, and missing one can leave gaps in immunity. I've seen too many families bring a puppy to the grooming shop thinking they're fully vaccinated when they've only had 2 of 3 rounds. Write series in bold next to these pets' names, and don't consider them complete until your vet confirms the final booster is done. Flag lifestyle vaccines based on actual exposure risk. Leptospirosis, canine influenza, Lyme disease, and feline leukemia vaccines aren't universal. They depend on whether your pets encounter wildlife, standing water, ticks, or other animals. My dogs hike with me, so they get lepto annually. My clients' indoor cats usually skip FELV after their kitten series, unless they go outside. Don't vaccinate just because it's on a list. Talk to your vet about what your household actually needs. Build in 2-week buffer windows before due dates. Life happens. The vet's booked, someone gets sick, you forget to check the calendar. I mark every vaccine as due 2 weeks before the actual expiration date, so I have wiggle room to reschedule. This habit has saved me multiple times when my grooming schedule gets slammed and I can't take a morning off on short notice. Keep a photo of each pet's current vaccine certificate on your phone. Boarding facilities, groomers, dog parks, and emergency vets will ask for proof of vaccination, and digging through paper files in a parking lot is miserable. I take a picture the second the vet hands me the certificate, label it with the pet's name and date, and file it in a phone album called Vet Records. Takes 30 seconds and has bailed me out dozens of times. The broader challenge of managing a multi-pet household extends well beyond vaccines, but this is the foundation. If you can't keep track of who's protected and who's overdue, everything else falls apart. Moving on to preventative medicine and parasite control organization. Create a monthly preventative medicine station with labeled containers for each pet. I use a small plastic drawer unit with 1 drawer per dog, and on the first of every month, I dose everyone before I feed breakfast. Heartworm pills, flea and tick topicals, and dewormers pile up fast when you're managing multiple pets, and it's shockingly easy to double dose one animal or skip another entirely if you're winging it. Match flea and tick products to each pet's species and weight. Dogs can tolerate permethrin-based spot-ons. Check the show notes for a link to the current price, but that same ingredient is toxic to cats. I've had clients rush cats to emergency after accidentally using canine products. Verify weight ranges every 6 months because growing puppies, weight loss in seniors, and that chunky cat who finally slimmed down all need dose adjustments. Write the current weight and product name on each pet's drawer or container. Separate oral and topical preventatives into different administration days if you're prone to confusion. I give heartworm pills, which are oral, on the 1st of the month, and apply flea and tick topicals on the skin on the 15th. When I tried doing both on the same day, I'd space out mid-routine and couldn't remember who got what. Splitting them keeps my brain from short-circuiting, especially during busy grooming weeks when I'm already fried. Log every dose immediately in a spreadsheet or app. I keep a simple Google Sheet with columns for pet name, product, date given, and who administered it, me or my partner. If you skip this step and rely on memory, you will end up staring at a pill pack 2 weeks later with no idea whether you gave it or just thought about giving it. My vet also loves this log when we're troubleshooting anything health-related. Stock at least 1 month ahead for all pets. Running out of heartworm prevention mid-month because you forgot to reorder is a nightmare. Your vet may require a new heartworm test before restarting, which means an appointment, a blood draw, and a delay. I set a recurring reminder on the 20th of each month to check my inventory and reorder anything running low. Keeps me from scrambling at the last minute. Coordinate parasite prevention with your pet's actual exposure patterns. Year-round heartworm prevention is non-negotiable in most regions, per the American Heartworm Society guidelines, but flea and tick product intensity might vary by season depending on where you live. My dogs get full-strength flea and tick control spring through fall, then I switch to a lighter protocol in winter when ticks are dormant here. Ask your vet what makes sense for your climate. Don't just follow the national average. Keep a separate chart for deworming schedules. Puppies and kittens need deworming every 2 to 4 weeks until they're several months old, then less frequently as adults. If you've got a mix of ages like I do, senior dogs plus a young foster now and then, these timelines don't sync up. I tape a deworming chart inside the medicine drawer so I'm not digging through records every time I need the info. Understanding why pets fight over food and resources helped me realize that preventative medicine time can also trigger tension if one pet gets attention and treats while another waits. Now I separate them into different rooms during dosing to avoid conflict. Choose one centralized location for all physical and digital records. I keep a 3-ring binder with dividers for each dog, and every vet visit summary, lab result, vaccine certificate, and prescription goes into the corresponding section the day I get it. I also scan everything and store PDFs in a Google Drive folder with the same structure. Redundancy sounds excessive until your house floods, your phone dies, or you're at an emergency vet at midnight and need records now. File visit summaries chronologically with the most recent on top. Each section in my binder starts with this month's records, then works backward. When my senior dog developed hip issues, I could flip open her section and immediately see the progression over 6 months. X-ray dates, prescribed NSAIDs, weight tracking, everything in order. Vets appreciate this too when you're switching practices or getting a second opinion. Track prescription refills with dosage, quantity, and refill dates. My shepherd takes carprofen daily for arthritis, and I note every refill in her section. Carprofen 100 milligrams, 60 tablets, filled March 15, 2026, expires September 15, 2026. This prevents the, wait, did I refill this last month spiral, and helps me spot patterns, like realizing we're going through pills faster because I've been giving an extra dose on hike days. Include behavior notes in medical records. Your vet needs to know that your terrier is reactive at the clinic, your cat hides for 3 days after visits, or your rabbit panics with restraint. I write these observations directly on visit summaries so every vet and tech who touches the file sees them. One of my dogs has severe vet anxiety, and noting requires pre-visit gabapentin and extra time has made appointments infinitely smoother for everyone. Maintain a current medication list as a single sheet reference. I have 1 page at the front of the binder listing every pet, their current meds, dosages, and prescribing vet. If I need to take someone to emergency care, or if a pet sitter is managing things while I'm gone, they can grab that sheet and have everything critical in hand. Update it every time something changes. Don't let it go stale. Photograph identification details for each pet. Microchip numbers, registration info, distinctive markings, and any tattoos, common for spay-neuter dogs or purebred dogs, should be documented with photos and written descriptions. I learned this when a client's dog got loose and animal control needed the microchip number immediately. She had no idea where the paperwork was. I now keep this info in both my binder and a notes app on my phone. Archive records for deceased pets separately, but don't discard them. When I lost a dog several years ago, I moved her section into a separate memorial binder. Those records still matter if I get another pet with similar breed health issues, or if a pattern emerges across my household, like realizing 3 dogs in a row developed food sensitivities and I should look at environmental factors. Now, annual exam and wellness visit coordination. Stagger annual exams across the calendar year if you have more than 3 pets. Trying to book 4 wellness checks in the same month is financially brutal and scheduling hell. I spread mine out. 1 dog in March, another in June, 1 in September, 1 in December. This smooths out the cash flow, keeps me from burning a week of PTO on vet visits, and ensures I'm not neglecting anyone for a full year at a stretch. Build a pre-appointment checklist for each pet. Before every visit, I note behavioral changes, appetite shifts, new lumps, limping, changes in water intake, anything I've noticed since the last exam. At the appointment, I'm not relying on memory while the vet is talking. I've got a written list I can hand over. Small things I'd forget in the moment, like she's been licking her paws more at night, often turn out to matter. Request copies of lab work at every visit, not just when something's wrong. Baseline blood work for healthy adult pets creates a reference point for later. My senior dog's kidney values were technically normal last year, but comparing them to her results from 2 years prior showed a slow upward trend, early enough to adjust her diet and monitor closely. If I only requested labs when she seemed sick, we'd have missed that window. Schedule dental cleanings proactively based on breed and age, not just bad breath. Small breeds and seniors often need annual dental work. Larger dogs with good chewing habits might go 2 or 3 years. I've groomed hundreds of dogs with dental disease that their owners didn't notice because they weren't looking in the mouth regularly. Ask your vet to show you what healthy gums and teeth look like so you know what to watch for at home. My terrier needs his teeth cleaned every 18 months or plaque builds up fast. My shepherd mix has great teeth and goes every 2 to 3 years. Book next year's appointment before you leave the current one. Vet schedules fill up fast, especially for wellness exams during popular months. I stand at the front desk and book the next annual visit right there. If I need to change it later, fine, but I've got a placeholder and I'm not scrambling 8 months from now trying to find an opening. Track senior pet wellness exams at 6-month intervals instead of annual. Once a dog or cat hits roughly 7 to 10 years old, depending on breed, size, and species, a lot can change in 12 months. My senior shepherd sees the vet every 6 months now for blood work and a physical. Catching early kidney disease, thyroid issues, or arthritis progression at the 6-month mark, instead of waiting a full year, has made a real difference in her quality of life. Coordinate wellness visits with routine grooming schedules when possible. I groom my dogs every 6 to 8 weeks, and I try to book vet exams within a few days of grooming appointments. That way, everyone's already clean, their coats are trimmed back so the vet can see skin issues clearly, and I'm already in appointment mode mentally. Small efficiencies like this keep managing multiple pets from feeling like a part-time job. If you're coordinating feeding times and spaces as well, the principles of multi-pet home safety apply here too. Reduce stress during vet prep by keeping pets separated and calm before appointments. Let's talk about emergency preparedness and multi-pet triage. Assemble a disaster-ready vet kit with critical info for every pet. I keep a waterproof folder in my car with copies of vaccine records, medical histories, medication lists, emergency contact numbers for my regular vet and the nearest 24-hour clinic, and photos of each dog. If we're evacuating or someone else needs to take my dogs in an emergency, everything's in one place. Identify which pets are flight risks, which are resilient, and which need immediate vet attention in a crisis. My senior shepherd stays calm in chaos. My terrier bolts and panics. If I had to choose who to evacuate first in a fire or flood, I know the terrier and the dog with hip issues go in the first trip. This sounds grim to think about, but having a mental triage order means you're not frozen by indecision when seconds matter. Know the after-hours emergency protocol for your area and program the number into your phone. Not all regular vet clinics offer 24-hour care. I have the nearest emergency animal hospital in my contacts as Emergency Vet, the address in my Maps app, and the fastest route memorized. I've driven that route at 2 a.m. with a sick dog and been grateful I didn't have to figure it out under stress. Keep a pet first aid kit stocked with basics for multiple animals. Gauze, vet wrap, antiseptic, a digital thermometer, a muzzle, even the sweetest dog may bite when injured, and a guide to normal vital signs for dogs, cats, and any other species in your home. I replace expired items every January and keep the kit in the same cabinet as my household first aid supplies. Run drills on loading multiple pets into vehicles quickly. My 4 dogs know load up means everyone into crates or seatbelt harnesses now, and we practice this regularly, even when we're not going anywhere urgent. During an actual emergency, a fire, an injury, a sudden evacuation, you don't have time to coax a scared cat out from under the bed or chase a loose dog around the yard. Drill it so it's muscle memory. Establish a plan for separation if one pet is contagious or injured. When one of my fosters came home with kennel cough, I had to isolate her immediately to protect my other dogs. I already had a spare crate, separate food and water bowls, and a plan for how to manage bathroom breaks without cross-contamination. Think through your space now. Where would you isolate a sick pet for a week or two? And how would you keep managing routines for the others while doing it? Here's the condensed list I keep on my phone and review at the start of every month to make sure nothing's slipping through the cracks. Are all vaccines current within 2-week buffer windows? Monthly preventative meds dosed and logged? Prescription refills ordered with at least 1 week to spare? Annual exams scheduled for the next 12 months? Physical records filed? Digital backups updated? Emergency kit stocked and vehicle ready?
Any new symptoms, behavior changes, or lumps noted for the next vet visit. I literally check this list on the first of every month while I'm dosing heartworm pills. Takes 5 minutes and has caught so many things before they became problems. Now, let's hit some frequently asked questions. How do I keep track of which pet got which vaccine without mixing them up? Use a combination of color-coded systems and written logs. I assign each pet a specific color on a shared wall calendar and keep a spreadsheet with every vaccine date, product name, and administering vet. Take a photo of each vaccine certificate immediately after the appointment and file it in a labeled phone album. Double-check at the vet's office that they're pulling up the correct pet's file before any injection, because errors do happen when names are similar. Can I sync all my pets' annual exams to the same month to simplify scheduling? You can, but it often creates budget strain and limits appointment availability. If you have more than 2 pets, consider staggering exams every 3 to 4 months so you're not paying for multiple full workups, dental cleanings, and vaccine boosters all at once. This approach also gives you more flexibility to get appointments during less busy times, and it means you're seeing the vet regularly throughout the year, which can catch problems earlier. What's the best way to manage vet records if I'm splitting care between multiple family members?
Create a shared digital folder, Google Drive, Dropbox, or a shared note-taking app that everyone can access, and establish one person as the record keeper who confirms that every new document gets uploaded and filed correctly. Keep a physical binder as backup, and make sure anyone who might take a pet to the vet knows where both systems live. Use a shared calendar app with alerts so everyone sees upcoming appointments and medication due dates. Don't rely on verbal communication alone. Here's where I'll leave it. Managing vet care for multiple pets stops feeling overwhelming once you've got systems in place that actually match how your household operates. I won't pretend it's effortless. I still occasionally forget who needs deworming or realize at 9 p.m. that I'm out of heartworm pills, but the structure keeps the chaos contained. Pick the methods from this checklist that fit your life, ignore the ones that don't, and give yourself credit for showing up consistently. Your pets don't need perfection. They need someone who keeps track, stays one step ahead of preventable problems, and doesn't panic when something goes sideways. From one multi-pet household to another, you're doing better than you think. That's it for this episode of Total Pet Parent Podcast. Thanks so much for listening. We've got new episodes dropping every Monday, Wednesday, and Friday, so you'll have plenty more coming your way soon. If this one helped you out, I'd really appreciate it if you could leave a 5-star rating and write a quick review. It actually makes a huge difference because it helps other pet parents find the show when they're searching for answers. And if you haven't already, hit subscribe or follow so you get notified the second a new episode goes live. I'll see you in the next one.